So I just want to first introduce Penelope. She's going to tell you more about herself shortly, but uh, thank you for inviting us to do this session. And as you'll soon see, engaging with older adults, caregivers, and stakeholders in research is something that Penelope and I are both very passionate about. And I thought how better to facilitate this conversation than with multiple multiple perspectives on this conversation. So I'm a health research methodologist by training. I've worked in an HIV hospital for over 10 years, facilitating, leading, and collaborating on community-based research. And now as the managing director of the McMaster Collaborative for Health and Aging, which we will tell you more about. And then with Penelope, who's an older adult partner with the collaborative and an experienced research partner with tons of relevant lived experience that she brings wherever she goes. So we hope you'll engage in this conversation with us. And as Kenny said, if you're comfortable to turn on your camera, we're also going to be using Jamboard later. So hope that we'll put the link in the chat when we're ready for that, but hope that you'll also participate in that way. And we asked Jazine if she wouldn't mind setting up a poll. So just before we get started, we'd love to know from you if anyone has experience working with people with lived experience in the research process. So not as research participants, so not like in qualitative research and interviews, but as advisors or experts. And then our second question is, do you plan at this moment anyway on including engagement or partnership with older adults or caregivers in your mock grant proposal? All right, well, thanks so much. I'll post the results here. So there's a mix here, about a quarter of you that have experience working with people with lived experience in the research process. And I love the fact that no one said, no, I'm not planning on doing engagement in their mock proposal, but there is still room for us to sway those 5 who are unsure at this time. So I love that. And then also, if you wouldn't mind just popping in the chat, introducing yourself to Penelope. We're going to kind of take turns. So then when I'm talking, she can just read through. If you wouldn't mind just letting her know your name and maybe the program you're in, anything else you'd like to share, that would be wonderful. So I see there's the diversity of experience, and I hope that those of you who have experience, we welcome you to share that experience in this conversation and that we can all learn together. And Penelope and I have identified 2 types of goals for this session. So first of all, we hope that you come away from this session feeling excited and energized by the possibilities of working with older adults or caregivers and partnering in how you do research, perhaps in a slightly different way. We also, our learning goal is that we hope that at the end of this session, you have a foundational knowledge of community engagement in aging research, and that can be applied as you're reviewing research. So perhaps when you read your next paper, maybe wondering, did they have an older adult or caregiver on this team? Did they ask them? How were they involved in shaping or deciding on this question or informing the design of this intervention? That this might be helpful when you plan your future research or your mock grant proposal, and also, of course, in terms of how you might actually engage with older adults and caregivers in the future. So I'm going to turn it over to Penelope, who's going to introduce herself and tell you about, as she likes to say, why she keeps coming back for more.
I'm Penelope Petrie. I'm a longtime Hamilton resident, lived here most of my life. And I went to Mac and a great university. And I've been involved with the collaborative pretty much from the beginning. And I got my involvement came out of a research study that I saw an ad for, a little tiny ad in the paper. And they wanted to talk about an idea with the public, members of the public. And since I was going to be in the general area where this talk was being held that day, I decided I would drop in and see what it was about. And I found it quite interesting, especially that they were wanting members of the public and older adults and people with lived experience to actually take part, not as subjects. And so I spoke to, it was actually Rebecca Ganan, who was one of the researchers who was there. I spoke to her and came on board the little panel that they had set up. And just the way we were treated, it was a group of older adults, there were caregivers. I'm neither a patient nor a caregiver. I was there as a concerned citizen, but just our concerns, our questions, our comments were incorporated. They were talked about, and I felt that we were really considered to be a valuable part of the project. And so when another opportunity came up, I jumped at it because I'm learning. I'm basically have my whole life. I'm a very curious person, nosy, some people might say. I like to know what's going on. And I'm really interested in the aging process and health in older adults as I get older myself. And so as long as I feel I'm learning something and that my contributions are of value, I will continue to do this. That's me.
And yes, it's a real honor to do this together with you. So I thought it was important to acknowledge right up front how confusing the language can be in this space, and the language that is used to refer to research done in partnership or including the voice of those for whom the research is about or for varies tremendously based on the year it was conducted, the country in which it was done, the discipline, and then even within, for example, health research, the language differs depending on the community or the research focus. So I've put up here some words that you might have come across and seen, maybe some you've used and others you haven't. And obviously this is not a comprehensive list, but just to give you a sense, and I'm going to take you on a bit of a history lesson throughout this as well. So the first two that I have clumped together there are community-based research and participatory action research, sometimes referred to as PAR and CBR. They themselves are like convergences of many fields, but primarily are, and those terms started emerging maybe in the 70s, but was primarily within like advocacy groups and equity deserving groups, often using queer, feminist, Marxist, or indigenous theories, often within the like education or social work fields. And then the next set of terms you hear are more recent, perhaps more in the last, 10, 15 years, let's say. And as you can tell by the presence of the word patient, they're much more focused on health research. And these ones will vary more on your geography. So patient and public involvement is what they tend to use in the UK. Patient-oriented research is what we tend to use in Canada. Consumer involvement is what they use in Australia. And in the States, they often will use patient engagement or patient and public engagement. I put co-design here on its own because it's really like a hot topic word right now. And it can be used to refer to like a specific methodology, but often is like a blanket term that gets applied whenever someone partnered with stakeholders. So I feel like you can't assume anything when you see that word. You really have to kind of dive in and read in between the lines in terms of how they involved and how they worked with people with lived experience. So greater involvement of people living with HIV and or AIDS, and I'll touch a little bit more on this later, but this is like the idea that personal experiences should shape the AIDS response was first voiced by people living and dying with AIDS in the 80s. But this, which is referred to as GIPA, so greater involvement of people with HIV and AIDS, is a principle that was formalized in 1994 at the Paris AIDS Summit. And 42 countries actually agreed to support and enact this within their response to the HIV and AIDS epidemic. And even today, many organizations continue to formally adopt this principle in terms of how they operate. So in terms of service providing organizations, they might have board members, have leadership, have staff, and various levels and strategies of involving people with lived experience. The expression "nothing about us without us" I believe emerged within the disability movement, but has been very strongly adopted in other research domains, including harm reduction and mental health. And then on the right is more of the formal institutions or structures with government support for um, taking this approach to research. So again, in Canada, it's the Strategy for Patient-Oriented Research, which I'll touch on a little bit more later. In the States, there's the Patient-Centered Outcomes Research Institute, and in the UK, there's Involve. So really the there's lots of terms, there's not consistent use of any of them, I would say, but really the common principle or the thread that puts them all on that slide for me is the intent of going beyond academia and how research is done by involving those for whom the research is about and or for. But the level of which they are involved and the strategies and methods in which they participate in the research process differ significantly. So before we go on with our slides, we'd love your thoughts on how this applies to aging-related research and engaging older adults. So we'd love your thoughts on what the potential benefits of engaging older adults are, but also what are some of the concerns or considerations that need to be front and center in terms of operationalizing this. So I'm going to pop in the chat the link to our Jamboard, but I will also share my screen if anyone has difficulty going there on their own on another. And I welcome you to post your thoughts up there, but also unmute and share them, and I can write them in as we go. I think Penelope is gonna, so on the second slide here, I welcome you to put up your stickies on some of the potential benefits on the left or challenges or considerations on the right.
I think I'm just looking at the one that you put up, Sue.
Yeah, perfect.
Can we make them bigger?
Do you want me to read any of those out to you, Penelope, or can
No,
you see them?
no, now that they're, I can read most of them now, yes. Okay. So we've got lots of good ideas on the benefits. So that one I can't read. Okay. Yeah. Okay, lots of ideas here. Okay. So I like, I mean, the benefits, I really like the comments that are going there, the tackling issues that are actually important, because I think sometimes caregivers and individuals just see that an acceptable solution might be different than what the researcher necessarily is hoping to get. And so, sort of managing expectations that way. And projects that have outputs that are relevant to older adults, shaping the research questions. Those are all really, I think, really good benefits, and with a good group of older adult partners, they can have a big effect. The issues, the difficulties, and again, I think pretty much everything that's up here is something that I've thought about on the studies that I've been on when we've been actually been working on them. This one that says it takes more time, probably does, yes. Treats older people as a homogeneous group. There'll be disagreements amongst the older people. Now, that's not something that I have found in the studies I've been in. The older adults as a group have not, they might have had different perspectives, but disagreements is, I think, even too strong a word there. Definitely not a homogeneous group, and we've never been treated as a homogeneous group. So that's something that if you think about it in advance, doesn't have to be an issue. Funding, yes, funding is always a problem, but that's whether you've got older adults involved or not. Opera, how do you pronounce that? All perspectives rather than just the majority voice. That requires, and that's something that if you explain to the group why certain things have been incorporated and why certain things have been left out, that's really all. You don't have to put everything into action, but it's really good as a member of your older adult panel to know why such an idea wasn't added, because sometimes it's money, sometimes it's just time feasibility, sometimes it's simply trying to operationalize it. They just don't have time to work out a way to manage it. So, but as long as I know that my idea was not totally just dismissed because the researchers thought it was stupid, because if you're totally ignored, that's what you start to think. If it's acknowledged but impossible, I mean, we can all live with that. Right. And the top one here, again, that comes to diversity. The older individuals who are willing, able to engage may not be a representative sample. All studies, I think, are biased in terms of the people choose to take part. So that's a problem no matter who you're working with. So, okay. Is there any other one that you think I need to comment on particularly?
I think we can. Why don't we go back to our slides and we'll be able to come back to this
Okay.
later. And also, as you can all tell, you can continue to contribute to that
Mhm.
as you go. So um, somehow, sorry, my
Yeah.
somehow my slideshow has disappeared from my options.
It's not very handy.
No, not very handy at all. Um, all right. So thanks for that. I actually really loved the fact that there was more active discussion on the challenges because they are real, and to me it tells me that you've thought about this already. Um, so on this slide, I just wanted to distinguish and that some people may take this approach for an ethical or principle reason. And there's also people or promotion of this strictly based on its potential impact. And I think it's important to acknowledge this distinction and not that you might choose one over the other. Many people might take this approach for both reasons. So on the kind of ethical or principled side that I have here is that some people believe that on principle nothing should be done about people without them, including research. But you know, I admit, I'll be totally honest. I did my master's in a lab with a mouse model, under the framing of gene therapy in cystic fibrosis, and I had never known or met or spoken to someone who had cystic fibrosis, and yet I wrote papers about it. I wrote grant proposals. Um, and honestly, I didn't even really reflect on that until I heard someone living with HIV speaking like so passionately on how he thought it was, I'm gonna use air quotes here, wrong. Um, how he had met a researcher at our conference who was doing statistical modeling of HIV transmission in the community, and yet he had never spoken to a person living with HIV about their lived experience. Um, and so the reason I bring this up is that I know some of you might not, your research might not involve people. So it might be harder to imagine where and how you can meaningfully engage people with lived experience in informing your research. And I think that that kind of ethical or principle one is one that is clear in how it applies in my opinion. I think in terms of understanding how it could impact the actual design might be a little bit harder to understand with some research projects and research designs than others. But engagement can also contribute to transparency. Much of the research that is done with tax or public dollars. So by partnering and engaging community members and individuals beyond academia, we can increase transparency and democratize research. And so as you see up here, I have equity, diversity, and inclusion on both. And I have them with slightly different bullets because to me, it's so important to emphasize that if it is done well, it can contribute to addressing health inequities and for equity, diversity, and inclusion in of the research process and structure. Um, and then engagement or partnered research may also be pursued because of the impact on the research and in mobilizing the findings. So it may allow you to identify a more important topic, something that's more relevant to the community. So if we're thinking about interventions by involving people with lived experience, the intervention may actually be more effective because they can, based on their lived experience, can tell you what could work or what might not work, and what the barriers could be of operationalizing that. But also that can be more likely to be translated into action. And I've definitely seen that people with lived experience are often the the biggest champions for speaking up and sharing research results on the other side. But this also applies to engaging other stakeholders, especially when it comes to clinicians and decision makers. And so, for example, if a research team has a community member from an equity deserving community, their ability to advise on all aspects of your research to ensure that the research is relevant, respectful, known, feasible for members in their community can be unparalleled. So I don't know, maybe you guys can just put your hand up if you've seen this visual before. IAP2 stands for the International Association for Public Participation, and they've created the spectrum to help promote common language. As we saw, within this domain, we struggle with that. But this is specifically to identify the level of, in this uh, case, they're referring to it as public participation or engagement in a project or activity. So as you move from left to right, the public involvement is more intensive and impact or potentially impactful on the process. So I like this as an adaptation to that spectrum. And admittedly, I'm not a big fan of the use of the word patient, but I really like how in this version they have two rows, one from the perspective and what it could look like for the public participant or partner, and then from the researcher's perspective. And then in the bottom row, it also indicates some of the methods or approaches that might be used or what it could look like. So for example, in the collaborate or partner, there would be individuals, co-investigators, and members of an advisory or steering committee who are lived experience or from the public. And then in the lead or support is where the research is really driven by those with lived experience. And later I'll give some examples of this in the long COVID domain, where the lead authors, the principal investigators are individuals with lived experience. They're the ones who identify the question and all the way through how they operationalize that and how they communicate the results on the other side. But in addition to those kind of individual rows, what I really love about this is how they acknowledge that as you go from left to right, there's an increase in the time that it is required, the knowledge that is necessary, and the funds. And I noticed a number of people referred to funds and money for honorarium, and that's why it's so important to be thinking about this at the grant writing phase, because it's not that you can, once you have the funding and are halfway through a project, you can easily say, oh yes, I want to partner, because if it's not built into the budget, if it's not built into the timeline, it's difficult to do it well. And I think to me, what's really important to emphasize is that it, even though we read it left to right, it's not that the farther right you go, the better. And the far right is not going to be a fit for all projects, for all researchers. And I recognize that, especially for trainees, they have different constraints that impact them. And so I think it's really about this is for common language, for identifying what could be a fit. But I think what's also really important is that it's not one or the other, that you, in a single project, you might actually be using all of them. And I think that that is a really important piece to address some of the concerns that were on the Jamboard in terms of who are the representatives. So you're right, you are not going to get a representative sample from a community who are willing to be NPIs or PIs, co-PIs on a grant. But if you have people with lived experience on the kind of principal investigatory team, you can also use the consult and the participate, and whether that's through qualitative methods to gather broader lived experience, and then you're using others in a way that works for them, that they're interested in, that they have the capacity to participate in. Because another thing to me also, which was mentioned there, is that not everyone wants to either. And I think it's really important to recognize that, and thus provide multiple opportunities for levels of engagement. Um, so for example, one project that I recently did that was focused on harm reduction for those living with HIV. We had people with lived experience on the as co-principal investigators. We had people with lived experience as co-investigators. We had people with lived experience as PRAs, so peer research assistants. And those individuals had different interests and capacity. So there was one woman who really wanted to do the interviews, but was not interested or able to do the analysis and deal with a lot of kind of text. So we had another peer researcher who had those skills and very much enjoyed engaging with the project in that way. But we also had, qualitative interviews and surveys that were done, which enabled us, through the peer researchers who had those relationships, to reach and gather perspectives of a much broader community and population. So at any time, please feel free to interrupt, ask questions. So at the collaborative, we have a team of researchers and trainees who conducted a systematic review of health research that involved older adults as research partners, or engaged not as participants, but as advisors, to look at how engagement was done, and also, if they reported, what the impact was done. And so this systematic review is currently in the writing phase, but we recently released this research brief highlighting the findings, and this is available on our website, and happy to share these slides later if you're interested. But what we found was that it was more common for older adults to be engaged in the research projects once they were initiated, or in the mobilization phase. So less often in the idea or the research design phase. And you likely can hypothesize why that might be. If you don't have funding yet, it's hard to support them. There's also, it seems less tangible. It might be more difficult to engage in a conversation and a hypothetical if you want to partner on something that may or may not happen at any point in time in the next few years. And papers often reported how they engaged older adults, but less often on the impact. And what was interesting is, most commonly, the impact that they did report was actually the impact on the older adults themselves. So if you think back to that other slide that we had in terms of why you might take a partnered approach or engage older adults, we had like on principle, and then we had impact on the research itself. But you could add on there also the impact on those individuals that are engaged and invited to participate. And in the case of the systematic review, there was reports of people feeling less isolated, feeling like they had meaningful contributions and connection. And from my own personal experience, I have met and worked with people who felt like these opportunities changed their lives, like turned them around, gave them opportunity and purpose, gave them something to get out of bed for. And also really were just so passionate about using perhaps their trauma, their pain, their negative experience for something that they felt could help others, and that meant a lot to them. So this is a table from that research brief, and it lists the actual activities that older adults were involved in for different phases of the research process. So as I mentioned, it was less common in the preparatory phases, but when it did occur, it included activities such as, identifying research topics and questions, or informing the engagement process itself, or in terms of establishing an advisory committee and doing some research training. So I think really the culture is changing. Like I tell the story about, I took probably 15 grad courses through my master's and PhD. And at the time, not a single one talked about engaging those with lived experience or community-based research but you know their funding bodies are now emerging specifically for this type of approach, even within the health research domain. And then even more mainstream funding bodies are now requiring you to write a section on community engagement. Same with journals. There are new journals appearing specific to partnered approaches to research, but also journals such as, BMJ Open now requires a section on community engagement. There's frameworks now that are can be useful in how you report on your engagement. There are tools out for supporting the measurement of impact in engaged research projects. So again, I said I would just integrate a little bit of history in here. And to me, it's really important to acknowledge the history and those who came before us in shaping this cultural change. And to me, those who were dying and died from HIV and AIDS in the 80s were critical for pushing for changes in research and policy. But it took millions of people and thousands of protests. And this slide here is of an ACT UP protest outside of the FDA headquarters in 1988. And these were called die-ins, where people were demanding changes to how research was done and how decisions were made related to access and funding for treatment. And so just so that it's like not just because I worked in HIV research and within the community for a long time, but Anthony Fauci also agrees with me that we should credit those advocacy efforts in terms of really changing how we do research today. And I'll just read this quote, which is from a news article about the ACT UP, or the AIDS advocacy efforts in the 80s and 90s. Before AIDS and before ACT UP, all experimental medical decisions were made by physicians. Dr. Anthony Fauci of the National Institute of Health told New Yorker magazine in 2002. Larry, who was the founder of ACT UP, by assuring consumer input to the FDA, put us on the defensive at the NIH. He put Congress on the defensive over appropriations. ACT UP put medical treatment in the hands of the patients, and that is the way it ought to be. So I think here he acknowledges all the work and effort that it took, but also recognizing that those changes were difficult. And I saw the comments about paying honorariums, and like honestly, I've lost sleep this week because of changes in math requirements in finance for how we pay honorariums, and it is difficult, and it takes effort to move in the direction that I hope we will. So as an example of today, as I referred to earlier, I think that long COVID community is really kind of leading the way in terms of research that is where the power is really with those with lived experience. And this is just one example. There are patient-led research collaboratives internationally where, as I mentioned, it's people with lived experience who've come together, who identify their own research questions. They seek their own funding and conduct the research themselves, but they also very much partner with and educate researchers in research that might be identified in other ways as being important. And so here you'll see that these individuals are, I believe all of them are living with long COVID, all the named authors on this paper. So we started with a slide of all the different terms in which patient-oriented research was up there, but I wanted just to circle back a little bit to the Canadian context, one last little piece of history here. So in Canada, you often hear the term patient-oriented research, and that's because it relates to the federal strategy for patient-oriented research. And so this was led and published in 2011 by CIHR. And it was meant to address the gap that we know exists between what we learn in research and what gets done in practice and healthcare. So the vision, as they stated, is to improve health outcomes and enhance patients' healthcare experience through the integration of evidence at all levels in the healthcare system. And so while we often hook our hat on the word patient and the importance of engaging people with lived experience, if you actually read the strategy for patient-oriented research, it is also very much promoting the importance of engaging clinicians and decision makers at all phases. And also the importance, which I love about the Mirror grant call, is also the importance of having multidisciplinary teams. And so funding for SPORE, and with this strategy came federal and non-federal government support for actually enacting this. And so that's why you continue to see SPORE acronyms used in funding calls and organizations. I won't spend any time on this here. I'm going to turn it back over to Penelope to talk about, so with the SPORE came CIHR also wrote a companion patient engagement framework, which has guiding principles that Penelope is going to speak to.
Yes, I think, from this particular slide, I was just sort of thinking about the comments within the comments that were really struck home with me, integrating older adult perspectives, which I'm using the term older adult and I prefer it to patient, which I think is really important. Creating safe environments is really important. And cultural awareness. I think confidentiality you have to think about in terms of relating that to your participants. And in terms of a safe environment, think about jargon. It can be extremely off-putting to individuals who aren't trained in your field. Acknowledging that the older adults who are not scientists do have expertise and experiential knowledge, and that it has value to you and your study. And basically co-building true collaboration, which can be quite a challenge. But truly listening to people, listening to their perspectives, and doing your best to incorporate what they're saying into what you're doing and your research ideas. Next one, Sue. And then this is a second, these two slides are very similar. They cover much the same material. And again, partnership to me means authentic, mutually beneficial interactions. The individuals you're working with need to be getting as much out of it as you are. So it is important that all participants have something to contribute and to gain throughout the whole procedure. From my perspective, when you're working with older adults, it's important to provide timely follow-up to the participants about how their input informed decision-making, and if applicable, explain why some of the ideas were not being incorporated. And it is extremely important that respect is demonstrated. Genuine interactions using active listening skills are really vital. So. Whose is this one? You're mute, Sue.
Thank you. I was just saying we put those both up there because there might be, for example, if you're writing for a CIHR grant, we suggest you use the guiding principles that they have and that the actual terms that they use. And then you might use different frameworks and different principles if you're applying to other funding agencies.
Mm-hmm.
And I'm not going to spend time on this, but just wanted to circle back to the idea that if done well, engagement can really help researchers address health inequities and help promote fairness, equity, diversity, and inclusion, both within the research structures, but also within the research itself and the research outcomes. And so this is a Fairness is Excellence framework that the Ontario SPORE Support Unit has developed, and it also includes there's a supporting online module for this, and I find it very accessible. And yeah, if you would like to check it out, again, I can share the slides afterwards. And I think we saw on the Jamboard of like, well, how do you find people? And Penelope kindly pointed out that I didn't have a slide on this at the beginning, so she's kindly agreed to speak to this.
Yes, and I think that was brought up on as one of the on the Jamboard as one of the potential issues, and so we were just brainstorming a few ideas. And as someone pointed out, you're not all samples are biased because people choose to participate or not, and so choosing to opt in is. When I choose to opt in, I'm biased. You know, I am biased for some reason. So ask around, ask your parents, your neighbors, your grandparents, if they know anybody who might be interested in helping out. And like-minded, so your fellow students and your supervisor, whatever. They're embedding yourself in the community. For some people that might work, depending on which community it is that you are wanting to pull your participants out of. And then cultural community groups or organizations, they are quite valuable. You have to have a very clear description of how they will benefit by taking part, and be able to sell that to the leaders, who will then basically organize access to the members of the community. Health condition specific organizations, if that's appropriate for your study. Volunteering in a community-based organization if you have time and it is a good fit for you. In Hamilton, if you're looking for specific things, the City of Hamilton City Council has a number of very specific advisory groups. And again, you can apply to make a presentation if there is an appropriate one. There is one for newcomers, there's one for older adults, there's one for the LGBT community, a number of others. And you can apply through their liaison to make a presentation at their meetings again, and ask them if they know of people who might be willing to help out. Yeah, it's just, that is a challenge, but it can be done. Older adult centers, this, again, we have 5 or 6 of them, and older adult clubs in Hamilton, if you're looking specifically for older adults. making presentations to groups like service clubs so that their members become aware that you're looking for people to participate in a study, and you clearly define what you are looking for in the way of those individuals, whether it's an age group or a gender or ethnic diversity. Those are all places to start, but it's relationships.
I think your point there, Penelope, about reciprocity is like so important. It's not just like you asking of older adults, but what are you offering in return? And I think that it's important to consider that when you're approaching, other organizations, because maybe there's ways in which you can support the organization as a whole, but then also when you're building those relationships with individuals, to also ask them what they are looking to get out of it, and then finding individually how you can kind of support them back, because what gets people to the table can vary tremendously.
Mhm. Yes, but and especially I've found through another organization that I belong to, and who have done studies and tried to speak to different cultural communities, that it's you have to make a contact with someone, and they have to know that the community will get something back if they participate. There has to be a good in it for them, and so on a community basis and on an individual basis.
Mm.
But
Yeah. So I think that we talked about writing into your grants like honorariums and timelines and considering that, but there's many grants that I'm on. They also include like larger sums that are provided to the organizations that support
mhm,
them, as
mhm,
one way of recognizing the effort that it takes and the support and giving back to the community.
right, right.
So we did want to go back to the Jamboard, but I think in the interest of time, unfortunately, I think yes, Audrey.
Just wanted to say that, like, yes to what Penelope was saying about giving people something back. And it's something that I'm struggling with. How can we incorporate this into some of our funding mechanisms? Because I think it's so important and it's not typically done. But the example of not just like a gift card or funding, but sometimes people just want to know what happened with that study I was in, or what their particular results were. If you can share that, like, that takes resources, right? To dedicate some time to say, well, you did this mobility assessment and here's how it turned out for you. And here's what the rest of the population, like, people want to know that stuff and they really value it, right? I think that's part of it's not so much that stakeholder engagement, but you still, when you have people as participants, they become part of your community too, right? And working that in is not often done, and I've seen it done well in a few different studies I've been involved in. And anyways, I wanted to say yes when Penelope said that, because I really love it and I like to see when people pitch that.
Yeah, I mean, I could just say, yeah, some of the studies that I've been in, when papers have come out of them, all of the older adult participants have been sent copies of links to the papers, and so we know that something has come out of what we did. And and that's over and above any kind of an honorarium. And I mean, in my personal case, I would do what I'm doing without honoraria, but I know that for a lot of the people who are involved in the studies I'm in, the honoraria is budgeted into their life, basically.
Mhm.
So
Yeah, and I think there is some really great community-based like knowledge sharing events at the end that can happen,
yes.
with a meal. Like, it's also a celebration of their contribution, and then including them to be able to speak about their role within the broader kind of study findings and impact. I think, but again, I think it's great to build those conversations in, because everyone is looking for something different, but everyone appreciates updates and that continued like understanding of where their contribution is led.
Right.
So I realize we're at 2 minutes left, and this is our slide on grant writing. But to us, it was important not to start with the grant writing because you have it, but more to think about where does it fit within research broadly? What are the principles? But I will just emphasize, I think, like be creative, listen, leverage your team's networks. Maybe your supervisor has partners they've been working or other members of your committees or colleagues have partners they've worked with for a long time, or existing advisory committees that you might be able to informally or formally connect with. But to me, like a really like all those stars and the bold and the don't is really just considering if you're going to be asking people to join at the kind of grant writing phase, is you have to move your timelines way back, that you have to leave time for them to take 2 weeks to call you back, to have coffee or whatever, and start the conversation slowly, not be like, I need your CCV and a letter of support. And like, we operate in a certain way with other researchers, but like just remembering that that's not the way it happens when you're talking with about community members. So here was my plug for the collaborative, which we won't get to, but I did want to mention, as Audrey said at the beginning, next week, so November 29th, we have a collaborative conversation. So this is a seminar series that we've started at the collaborative, which are co-presented between kind of academically trained researchers and community partners. And they talk about their research project and how they integrated their partnered approach within that setting. So I know all 3 people who will be presenting at this one, and I think it will be fantastic. We would love to have you if you can make it. And after the 1-hour seminar, we have a half an hour, which is informal. We love for older adults trainees to stay and just chat and debrief on what they heard, what that might make them think about. In terms of the funding note that was up there with lots of exclamation marks on the Jamboard, the collaborative, another initiative that we have just launched, is a fund specifically for trainees. You can apply to us for money to support you in engaging older adults and caregivers in your research. So that money is primarily meant for the honorariums for you, but could also be for, meals or food if you're going to bring people together in person, or transportation, etc. So we've done our first launch. We'll have another call for this in the spring. Penelope, I'm going to give you the last word because I know it's 11:01. I'm sorry.
Yes, I know. So basically this was, sort of consider why and how you want your older adults or your citizen partners to be involved. Talk to anybody you can. If it's older adults, talk to your parents, talk to your neighbors about your ideas and what they think about how you're planning on incorporating these individuals into the study. Reach out is anyone, researchers who've done these collaborations, your fellow students, your trainees, your supervisor, learning more, like workshops like this. And as we say, write engagement into your grant. We are easy to work with.